Hello, I'm Robert Birch. Thanks for joining us. Almost 2 weeks after a special session of the legislature began, there's still no agreement on a plan to fill the state's $215 million budget hole. Unless a deal is reached soon, healthcare officials warn that there will be no choice but to make deep cuts that will affect hospitals and nursing homes across the state.
Although a special session of the legislature began on September 25th, there have been no votes on the floor of the House or Senate. House Speaker Charles McCall canceled a vote last week on a proposed cigarette tax when it became clear there was not enough support for passage. This week, House Democrats held a news conference to announce what they called a bipartisan budget plan that they believe could end the stalemate. The plan includes an increase in the cigarette tax of $1.50 a pack, increasing the gross production tax rate on new oil and gas wells to 5%, creating 2 new higher tax rates for high-income earners, raising the motor fuels tax by 6 cents a gallon, eliminating the sales tax exemption for wind manufacturers, and eliminating the sales tax exemption on certain luxury services. House Minority Leader Scott Inman claims the plan would raise up to $560 million in new revenue.
It's the only plan, the only bipartisan plan that not only backfills the holes to protect further cuts to mental health, health care, and to DHS, but also allows us to invest in things like public schools and teachers. This plan would include a $2,000 across-the-board teacher pay raise.
The proposal for a teacher pay raise drew support from Oklahoma Education Association Vice President Catherine Bishop, who nonetheless felt the plan didn't go far enough.
A large number of our education support professionals live below the poverty line, and this plan overlooks their need for a pay raise. And while this plan provides teachers with a much-deserved raise, it falls short of the significant pay increase they need. But today's plan gives us hope.
The proposal was also embraced by Johnny Tapley, the CEO of McCurtain Memorial Hospital, who says money is desperately needed to prevent another cut in Medicaid reimbursement rates.
As it stands, my hospital loses $1.2 million each year simply because we offer Medicaid services.
Earlier this week, the Oklahoma Health Care Authority announced plans to reduce Medicaid reimbursement rates by 9% if the legislature is unable to replace $70 million lost to the agency when the state Supreme Court struck down a cigarette fee. Healthcare Authority CEO Becky Pasternak-Eichert says they remain hopeful the legislature will come to an agreement that will replace the lost revenue, but they had to warn providers of the possibility of a rate reduction.
It's not something we can achieve overnight, so we really have to be transparent about our proposals publicly.
She's also aware how deeply this will impact providers, especially in rural areas of the state where the dependence on Medicaid is especially high.
And for them, a 9% reduction in their rates will be significant and cause them, I think, to really seriously consider whether they either continue to see senior care enrollees, or will they have to limit their panels somewhat for senior care.
Tapley says the hospital in McCurtain County already loses $3,200 a day by providing Medicaid services, and another cut would be devastating.
I have dedicated and passionate employees who have been furloughing for over 3 years. We've forgone raises for over 6 years. We operate with skeleton crews on shoestring budgets. And at the same time, we've managed to improve our quality of care, and we've managed to improve the services that we offer our patients. Let me be clear. We, rural hospitals, rural health care, cannot and will not survive any additional cuts.
The impact would likely be even greater to nursing homes, according to Nico Gomez, CEO of the Oklahoma Association of Healthcare Providers. Gomez says Medicaid funds about 70% of the nursing home beds in Oklahoma, making the industry extremely susceptible to cuts in reimbursement rates.
We could lose potentially up to 50% of the 300 homes that are in the state. We could displace 11,000 residents. 11,000 employees could be looking for new work.
Inman says he's ready to sit down with the House Speaker this weekend in hopes of hammering out a deal on the budget plan.
If he has any tweaks that he would like to offer to it, our caucus is certainly willing to compromise. We've already demonstrated that by accepting this plan as it is in a major compromise fashion. And so the hope is that come Sunday evening, when the Speaker and I sit down together face to face, that we'll be able to take the bones of this plan, and if he wants to tweak a few things here and there, my caucus is willing to have that discussion.
But late Thursday, Governor Mary Fallin threw cold water on all the talk of an agreement to solve the state's budget crisis, telling reporters if there's only one person at the altar, there is no marriage.